Dairy farming is a useful activity for rural development, employment and sustained income, and acts as an insurance against several risks such as drought and income loss. Poor productivity as well as the quality of production and products remains a cause of concern in the Indian livestock and dairying sectors. These problems might be due to factors such as the lack of improved breeds and breeding services and lack of targeted preventive animal health care. An effective and efficient disease prevention and control strategy is therefore of paramount importance to alleviate these effects. For this purpose, farmers need to understand the common diseases and vaccination of cattle livestock. Foot and mouth disease or FMD. Foot and mouth disease has very severe implications for animal farming since it is highly infectious and can be spread by infected animals comparatively easily through contact with contaminated farming equipment, vehicles and clothing. Its mortality rates are very low for adult cattle but very high for young cattle. Its signs are fever, formation of vesicles and blisters in the mouth, udder, teeth and on the skin between the toes and above the hooves. Its containment demands considerable efforts in vaccination, strict monitoring, quarantines and occasionally the culling of animals. Mastitis in dairy cattle is the persistent inflammatory reaction of the udder tissue. Mastitis, a potentially fatal mammary gland infection, is the most common disease in dairy cattle. It is also the most costly to the dairy industry. This disease can be identified by abnormalities in the udder such as swelling, heat, redness, hardness or pain if it is clinical. Other indications of mastitis may be abnormalities in milk such as watery appearance, flakes or clots. Treatment is possible with long-acting antibiotics. Cows being treated may be marked with tape to alert dairy workers, and their milk is siphoned off and discarded. Vaccinations for mastitis are available, but they only reduce the severity of the condition and cannot prevent recurring infections. Practices such as good nutrition, proper milking hygiene, and the culling of chronically infected cows can help, ensuring that the cows have clean, dry bedding decreases the risk of infection and transmission. It is characterized by an acute, highly fatal septicemia with high morbidity and mortality. Hemorrhagic septicemia disease outbreaks mostly occur during the climatic conditions typical of monsoon. That in 6 to 48 hours after onset of clinical signs, recovery is rare. A fever, dullness, and reluctance to move are the first signs. Depression, salivation, and nasal discharge. Painful, oedematous swelling of the throat, extending to the brisket. Congested mucous membranes, respiratory distress. Black quarter disease. It is an acute infectious and highly fatal bacterial disease of cattle. Buffaloes, sheep, and goats are also affected. Young cattle between 6 to 24 months of age in good body condition are mostly affected. It is soil-borne infection which generally occurs during rainy season. Signs for this disease are loss of appetite, depression, dullness, suspended rumination, rapid pulse and heart rates, difficult breathing, lameness in affected leg, crepitation, swelling over hip, back and shoulder. Foot and mouth disease vaccine. The FMD vaccine is given to 4 months old cattle livestock or cows and continue with booster dose vaccine every 6 months. Combined hemorrhagic septicemia and black quarter vaccine. This vaccine is given to 6 months old cattle livestock and continue with booster dose every year. Brucellosis vaccine. This vaccine is given only to female cattle calves and buffalo calves of age 4 to 8 months, once only against Brucella abortus infection. There are also vaccination given to the cattle livestock only when there is an outbreak, such as the anthrax vaccine, which is usually given to 6 months old cattle after 1 month of its outbreak. Many animal health problems can be controlled with good management, proper nutrition, and vaccination against infectious diseases. Vaccination can play an extremely important role in the promotion of psychological well-being of animals through disease prevention and disease control. To know more about how to take care of your cattle, please visit your local veterinary.